Amanda Mendes. I'm doing my validation, my head to toe assessment validation for New England Tech. First, I'm gonna start by washing my hands. I'll wet them first. Soap, lather up. I'm gonna go grab my patient from the waiting area. Kristen?
Hi.
Hi, Kristen. My name is Amanda. I'm gonna be your nurse today.
Nice to meet you.
Nice to meet you as well. We're gonna get your height and your weight so we can get your BMI. Is that okay?
Yes.
All right, great. Let's go right over here. Scale. Could you step up on the scale for me? Now I'm actually going to have you turn around and face the other way so I can get your height. All right, you're all set. You can step forward. Your BMI today was 21, which is within normal limits. That's very good.
Thank you.
Right this way. Now we're going to go back to the room, but I do have to ask you a few things before we go back to the room.
Sure.
I need you to walk heel to toe. Now up on your toes. On the heels. Good job. Now let's go right into the room. We're going to provide some privacy. Let's get your waist circumference first. Just need you to lift up your arms for me, please. And go right at the umbilicus. Here's your belly button. And it was 28, which is very good, within normal limits. All right, now, Kristen, we're going to do a couple of exercises before I have you sit down.
Okay.
Can you bring out your arms like this? Roll them. Good job. Bring them down. Now lift like you're doing weights. Very good. Lower your wrists. Lift up each leg. Now roll your ankles.
Sorry.
It's kind of silly, I know. Okay, that's very good. Everything looks good with that. Now I'm going to stand behind you. I'm going to have you close your eyes for me for a couple of seconds. Very good. You can go ahead and open them. Now I need you to bend forward and touch your toes. I'm checking for lordosis, kyphosis, or scoliosis here, and the patient is negative for all of them. You can stand back up. All right. You can take a seat for me, please. Now, what we did there was we asked the patient to get her Romberg's, and it was negative. We tested for scoliosis, lordosis, and kyphosis, and it was all negative as well. The patient's gait was normal, as we've seen in the video with her walking. Do you know where you are today, Kristen?
Yes, I'm at New England Tech.
Okay. And what are you here for?
I'm here for a physical for a new job.
Great. What time was your appointment?
12:30.
Okay, perfect. Now, can you state your name and date of birth for me?
Sure, it's Kristen Goodwin, 8989.
And do you have any allergies to any medications?
No, I do not.
And do you have any pain today?
No.
Great. So let's go on with the rest of the exam. Noting this, the patient is alert and orient times 4. She's dressed appropriate for the weather, and she's noted that she knows where she is, time, place, person, or and situation. Next, we're going to assess your cranial nerve. So I need you to, your cranial nerve 7. So I need you to just puff out your cheeks for me. Raise your eyebrows. Lower your eyebrows. Frown. Smile. Stick your tongue out. Left to right. Very good. Now we're just going to inspect the hair for any infestations. We're just looking at everything right now before we start palpating anything. The patient's hair looks free of infestations. And I'm looking at her ears, her eyes, her nose, and her trachea, and everything is symmetrical and midline. Now we're just going to inspect the hair, and it is free of any infestations, any masses, or any abnormalities. Now we're going to examine the patient's ears. So first we're going to palpate the pinna on each ear. Is it okay if I do that?
Yes.
So squeeze each ear. Everything looks good. There's no drainage. If I had an otoscope, I would take the ear, pull it back, pull the pinna up and back. For a child, pull the pinna down and back. And also, if I had an otoscope, I could see the tympanic membrane, and the tympanic membrane would be a pearly gray color and translucent. Now we're going to inspect the patient's nostrils for any drainage. There's no drainage, and there's no cracks. Her lips have no cracks or any abnormalities. We're going to do an eye test. I need you to follow my pen light. Leave your head where it is. Just follow the pen light. Very good. Now one last test. I need you to look straight at me, and I'm just going to flash the light right in your eyes. I'm going to check for your pupils. Very good. The patient's eyes the pupils were equal, reactive, and accommodation to light and convergence. Next, we are going to have the patient close one nostril so we can see the deviation of her septum. Just need you to breathe out for me. Good job. Now do the other nostril for me. Great. There is no deviation. Last, what we're going to do is we're going to look in the patient's mouth. Are you wearing any dentures today, Kristen?
No.
Great. I just need you to open up and say ah for me. Perfect. You can close. There was no dental caries. The gums were pink, moist, and her the trachea, the uvula went up and back like it's supposed to when she said ah. Now we are going to palpate the patient's sinuses to see if she's having any pain. Is there any pain when I put pressure here?
No.
How about here?
No.
Very good. Now we're going to palpate the patient's lymph nodes. We're going to go to the pre-auricle, the post-auricle, the submaxillary, and the subclavicular. And none of her lymph nodes were enlarged, which is very good, which is what it's supposed to be. While we're here, we're going to check the patient's skin turgor, and there's no tenting on the skin, and her skin is warm pink, and is right now I can see her chest. It's free of any lesions. Now what we're going to do is now that we've already inspected her chest, we're going to palpate and percuss her chest. We're just going to put our hands slightly on her chest to feel for any masses. And everything, there's no masses there. Now we're going to palpate. We should hear resonance. When we palpate, which we do, which is very good. Now we're going to auscultate her lungs. We're going to auscultate in 6 different spots. I just need you to take a deep breath for me with your mouth open. Again. Perfect. The lungs were clear and equal bilaterally in the anterior thorax. Our next step is we're going to check the posterior thorax. So the first step is we're going to inspect, of course. We can see that there's no abrasions, no bruising, no lesions on the patient's back. Now we're going to just palpate, but I need her to do me a favor. I'm going to just move my hands. Every time I move my hands, I need you to say 99 for me.
99, 99, 99.
Perfect. When I did that, I was checking her tactile phlebitis, which is, it should have, the echoing should have gone down as I went down, and it did. Now, Kristen, I need you to take a deep breath for me. I'm just checking her thoracic expansion. Her thoracic expansion was normal. My hands separated at least an inch. Now we're going to auscultate her lungs and on the posterior side of her thorax. Now I need you to take a deep breath from me again, just like the front. Good job. Very good, Kristen. Okay, perfect. Now I'm gonna have you lay down. Would you be able to remove your shoes?
Yes.
We're just gonna lift the bed up to a 45-degree angle and away so I can easily assess her with the height. With the 45-degree angle, we're gonna be able to check for any jugular vein distension in her neck. Sorry, this bed takes forever.
That's fine.
Okay, Kristen, we're gonna check for jugular vein distension. So I need you to turn your head that way for me. Perfect. Now turn your head back this way for me. Wonderful. Okay. And we're gonna check all of your pulses. So we'll start with the head and work our way down. And then I'll work my way back up and we'll listen to your heart sounds. Is that okay?
That's fine.
All right. So we're gonna do the temporal bilaterally, the carotid one side at a time, her brachial bilaterally, her radial bilaterally. And while we're here, what I'm going to do is I'm going to look at her fingers. She has no clubbing, and I'm going to check for capillary refill. And her capillary refill on that arm was normal, under 3 seconds, as well as this hand. Next, we'll go to the palpate. Then we're going to apply a pair of gloves. And we're going to get the posterior tibialis and the head pulse. So we'll get the posterior tibialis, which is back here, and the petty pulse, which is here. All of the patient's pulses were equal bilaterally all the way down. Now I'm going to have the patient, Kristen, I'm going to put pressure on your feet. I just need you to resist against me. Perfect. And lastly, we're going to do the Babinski reflex. Perfect. We're going to work our way back up. We're going to check the patient for any edema in her legs. She has no edema, no pitting in her legs, which is very good. Now, Kristen, what I'm going to do is I'm going to listen to your heart sounds. Is that okay with you?
Yes, that's fine.
We're going to first listen with the diaphragm of the stethoscope. We're going to go to the second intercostal space to hear the aortic. Next, we're going to go to the left of the sternum, the second intercostal space, to hear the pulmonic. Now we'll go to the third to hear Erb's point. We'll go to the fourth to hear the tricuspid. And lastly, we're going to go to the mitral, which is at the fifth intercostal space, midclavicular line. And if I needed to get the PMI, I would listen here for 1 minute. My last step is we're going to go listen to the heart sounds backwards with the bell of my stethoscope. The patient's heart sounds were normal, and she was free of any murmurs. Now, lastly, what we're going to do is we're going to take the bell of the stethoscope and listen to her carotid artery on both sides. That was clear for bruise. Our last step of our head to toe assessment is I'm going to lower the bed. Are you feeling any pain?
No.
Are you nauseous, or have you been vomiting at all?
No.
Okay. The last step is to look at your abdominal first. Also, I forgot to note too earlier that the patient's chest, she has no labored breathing, and she has no barrel chest. Kristen, would you be able to lift up your... Perfect.
Is that okay?
Yes.
Okay.
Fine. First, we're going to inspect the patient's abdomen. There's no lesions, no masses, no abnormalities seen. Our next step is we're going to auscultate the abdominal sounds. We will start with the right lower quadrant and work our way clockwise. We're going to listen to active bowel sounds. There should be 5 to 35 clicks per minute. If there was not, I would listen at 5 minutes for each quadrant. Also listening right here for any aneurysms or bruits heard. The patient had normal active bowel sounds and no bruits were heard. Next, what we're going to do is we're going to percuss the abdominal cavity, and that what we should hear is tympani. So we'll start again with the right lower quadrant. Perfect. That was the sound that we wanted to hear, was tympani. Next, what we're going to do is we're going to palpate with light palpitation on the abdomen. Just going in 1/2 inch on each quadrant. Are you feeling any pain while I do this?
No.
Any nausea or vomiting while I do this?
No.
Last, we're going to test for the deep palpation, which we're going to go just a little bit deeper. We're checking for any masses. No pain when I'm doing any of this?
No.
Okay. Perfect. We can lower your shirt. Wonderful. And Kristen, we are all set. I just need to check one last thing, if you don't mind.
Sure.
I have to percuss your chest. Slow with those feet. Do you mind if I just percuss your chest real quick?
That's fine.
What we're hearing is resonance, which is what we should be hearing on the patient. All right, are you feeling dizzy? Any nausea, any vomiting right now?
No.
All right, so let's lower the bed to the lowest possible position. Your call bell is right here if you need anything, and we'll be back with you when we need to come back to see you again.
Thank you.
Thank you so much, Kristen. Have a great day.
You too.